In a world where talent is evenly distributed, but venture capital is concentrated in coastal silos, smart startup money is heading for the Midcontinent. Welcome to the Midcon Markup, a podcast that uncovers the inspiring stories of our visionary tech entrepreneurs and the investors who believe in them. I'm your host, Cody Merrill with Cortado Ventures. Listen, learn, and make your Midcon Markup.
Welcome to another episode of the Midcon Markup. Today, we're fortunate to be joined by Deborah Moorad.
Thank you, Cody. I'm pleasure to be here.
So, Deb, you're a biotech extraordinaire. You've had a lot of success. You've done a lot of different things. Before we get into your professional history, can we take a step back into your childhood? What was it like? What were your inspirations? What has led to such outsized success and mission orientation?
Wow. I've been asked that question a few times, and I always respond typically with a story about my grandfather, because I was very fortunate and still fortunate to have such a supportive family that really helped me and promoted my dream and encouraged a dream. But also, I think that there was more than just that piece. It was also when you grow up and you have all of your friends in the neighborhood and you talk about where you want to be when you grow up. There was that pull that we all knew we wanted to make a difference in society or make a difference somewhere. So there was also that drive as well.
It sounds like you had some very formative childhood experiences and you had a very supportive environment, and that gave you the encouragement to branch out from the straight and narrow career path. What was that like, right? Because you were always interested in medicine. You were very far down the track pursuing a degree in medicine. And then at some point along the line, you decided to make a detour that you actually had too much entrepreneur in you. Walk us through the thought process.
Yeah. And so I don't want it to be taken lightly that, although my family and friends are and were very supportive of me growing up to this point of my journey and continuously still now, there was still a lot of heartache and hard work, and you don't know you're going to get there, right? So there was a lot of that, and I actually reflect on that often. But making that decision to really step out and go after what is in my heart was a very hard challenge, because you feel like you have all those people that are counting on you for this dream that in some ways is your dream, but it's also their dream because they want to see you be successful and not worry and have this career. And you're telling them, for me, what's really, truly down in my heart is going at something in this direction. And what happened in the course of my journey, and part of it, which also brings success, is because I have a love for research and a love for medicine. And my track was med school and to be a surgeon, a cardiovascular surgeon. And along the way, I learned about venture capital. I learned about patents and kind of what it takes to make a biotech company. And that story really resonated with me and spoke to my heart, because when I was that person playing basketball with my friends on the court and talking about our dreams, there was that side of hustle and grit and all those things that we needed to do. And not that that's not found in a bench scientist or a cardiovascular surgeon, but there was just something different about that core. And so I knew immediately at that moment, and I can tell you it was a struggle, because in med school, they'll ask you, what do you want to specialize in? And you're kind of droned into this. I'm going to be an anesthesiologist. I want to work in oncology. I want to be a cardiovascular surgeon, and you're picking your end path in some ways. And that frightened me. But for whatever reason, what didn't frighten me was this career that I didn't know where my paycheck was going to come next. But it was okay, because I'd already grown up that way, right? I could see my mom's struggles growing up, and she always made things work. And so I know And I knew at that point that if I believed in this, and this is what I wanted to do, it would work. And that's essentially what happened, right? I came home, my family was devastated, but it was more or less, I can make this work because this is what's in my heart, and continuing to do that. And so here we are now, looking back at something that maybe shouldn't have worked, right? And it did it's really just sets me back, and just completely thankful.
So it's one thing to be young and cocky and to thumb your nose at your mom, but it's another to actually make it happen. So can you walk us through those formative career experiences that gave you the confidence, the skills, the network to be able to execute so well as a biotech entrepreneur?
Yes, so I've had this conversation a few times here recently about relationships. And at one point, probably in my life, I would have not said that relationships were not important, but I would have told you that anyone can make a relationship that's lasting and move things through. And I will tell you now that that's not true. There's something about being very genuine and loving and having this passion for what you do that makes a mold that's a little bit different. And I can kind of go through the calculation of before starting like my first venture and really researching and finding those people that had that kindness and compassion that really helped me find that fitting where I was at. And that stuck with me, from the first venture with Oklahoma Medical Research Foundation, which was a repurposed drug for glioblastoma, to working on a merger with Dentsply Sirona, which was actually one of the largest mergers and deals in the dental space to the state. And then also going to Nature Technology, which we, of course, know acquired by Danaher. The technology sits in the home of one of the Danaher companies, Aldebaran, and then now sitting with Carixer. So really, I can tell you all the things about education and reading, scientific articles, all the things that would make you incrementally better, in your career and at that point. And all of those things are important, but also being able to tie all those relationships and connect the dots is really what helps you propel and move forward in a different way.
So a lot of people have this idea of a biotech entrepreneur as this mad scientist toiling away in the lab for hours on end, having some eureka moment, and then they're off to the races. It was really interesting to hear you start your explanation for your success with relationships and soft skills. Was that a misnomer that you also had about the industry that you've later circled back and realized that everything in life is relationship centric? Or what was the evolution like?
That's a really good question. It almost makes me laugh because probably one of the most difficult things for my my grandparents and my mom, my immediate family, because they spent a lot of time working at me I was not the person that would speak to someone in this type of setting. I would hide behind people. So I was probably the person that you would imagine, or what would be a biotech scientist, or
the nerd in the lab.
I was definitely, I had this plan of how I was going to work through, from a very young age, what it took to get to college, what credits you needed in college to get to med school. It was a methodical path. And it wasn't that the relationship wasn't important.
Where did that come from? I don't know any kids who operate that way.
My brother is basically, he's a little over 12 years older than I am. And so my brother and I we're cut from similar cloths, but a different cloth. And so seeing my brother not do well in school and all of his turmoils at a very young age, it made me just want to pick up an algebra book in kindergarten and start learning math equations. So it probably wasn't your typical nuance of what you would see. It wasn't, my family wasn't telling me to study more, work harder. They did, but it was truly natural in I'm not going to get in trouble. That's really probably where it stemmed from, because hearing those conversations, especially with my mom, talking to my brother about the importance of education and your future and all of those things, and having my brother come home with a bad grade or making decisions on college that were not. And that was probably what was also hard for me coming back and changing my direction, right? Is because I completely pivoted. I think they're almost over
Your
it
poor
now.
mom
I know.
at one point was like, I've been through this before. I'm going to have a doctor.
Yeah.
Whoop.
Yeah, totally. And I think that's just because your family, and I it's interesting now because I've spoke to a lot of individuals, and I do want to come back to this relationship piece that you did initially ask me. But I do speak with a lot of individuals now, and they're like, will you meet with my son or daughter and just tell them about your journey? And it brings it brings back a lot of memories on my end. But I also am very transparent. Especially last week, I met with a really good friend, her son, that is going to go, his plan's medical school, and he's just starting his first year of college. And he had his indication wrapped out of what he wanted to do when he goes to med school, really looking to dive all into it. It brought back some memories, and his route was oncology. I mean, I had a Play-Doh model of a heart. I could make an aorta like no one's business. I mean, I was in it. And sharing, there's all these different pieces, and explore it. And even though you have, like, my grandfather would take me to volunteer with him, and with the Shrine Hospital. And I would see that in elementary school. So I would see all of these.
Was he a physician?
No, and my grandfather actually just volunteered through Shrine Hospital. And it's interesting, and he was more business sided. So I think what happens when you have a family that's, you can have the physician side, but also the business side, they understand the volatility in business. So they want you to do something more stable. And that's why your family pushes you maybe to be a doctor or a lawyer or a more maybe respectable position, but it's not. There's much love in the business side. But coming back to that relationship piece, I always, was very, my friends, I've had some of my same friends forever, my whole entire life. And there's a lot to be said when you have a lifelong friend, right? And then in business, I have friends in business that are my friends, but they're also my lifelong friend in business. I've known them since growing out. And this has really been a journey also for me, not on just the relationship side, because those relationships, I think you're a person that's good at building relationships. That's great. But it really does play into all the things that you do. Because in the end of the day, with biotech, you are selling the scientist and you're selling the team, and they're investing in you. And so just like Cortado Ventures or another venture firm, when they're looking at you and your team, there's a lot that comes into play. Of course, you want the exit, the return, all those items, but it's the team that gets you there. And those relationships help those team and build it all the way.
Can you share the story of Nature Technologies with our audience?
Yes. So Nature Tech, and this also comes to the relationship side as well. I actually met Nature Tech about almost 10 years prior, when I was working on like one of my first startup ventures for Oklahoma Medical Research Foundation. They didn't have any technology at all at that point. They might have had maybe the plasmid manufacturing process, but it wasn't necessarily, all the patents weren't there. But they didn't have the nanoplasmid, which is the vector used for a lot of the gene therapy, CAR T therapies. It's actually under Aldebaran right now. So if you're interested in a vector, you can look up the nanoplasmid at Aldebaran, one of the greatest technologies in that space.
So the innovation was the delivery mechanism.
The innovation was the vector used in science. It was also the plasmid manufacturing process to make those therapies move forward. And we also had the strain. So we had actually 3 technologies under Nature Tech. And so Nature Tech was really interesting. And I wanted to bring up that I met them years prior, because this company was a service company. It wasn't thought of as a technology company. And so I had actually had a couple ventures under my belt, right? I had moved a technology forward to clinical trial that was later acquired, that's still in clinical trial today for oncology. Had a merger I worked through with all these key opinion leaders, and it really set perfectly with timing in some ways for me, because it was really that next step of I'm working all these things. And so what's that next venture or what it's going to look like?
As the proprietor making progress in biotech, like you're hitting clinical milestones, but like, what are you really doing? Like, how much of that time are you in the lab versus are you navigating different relationships and connecting a loose dots and saying, I have some special technology here. Somebody through the grapevine I heard has something over here. Let me put these Legos together. Like, what exactly is Deb doing?
It's all of the above. I mean, it's from, I can tell you at Nature Technology, it's from waking up in the morning and going into your lab and when there's dishware. So when we were doing all the plasmid manufacturing process, we would send out research grades so people could maybe test our plasmid manufacturing process or our vector, go in, and we didn't have automatic dishwashers in our lab. So we had to do that all by hand. So as a CEO, going in and washing those dishes, and helping out, learning how to run a fermenter. So you don't be shy to any of the process. It's probably similar to my friend Jill Castilla at Citizens Bank. I wouldn't be surprised if she's a teller short sometimes because someone's out and sick, and you might catch her like helping out on the front line because her desk is right there in the front office. And so it's very similar when it comes to my role, as a CEO for a biotech company. I'm not someone that sits back. I'm not just telling individuals, this is what we need to get done. It's me researching in terms of, the marketing landscape and where exit lies. It's how that technology fits inside a bigger portfolio. So for example, with Nature Tech, where does Nature Tech fit in at? Would it be a CDMO, a bigger player like Danaher, or would it be a smaller, not necessarily a smaller player, but more of an individual therapeutic like a company like Genentech or Pfizer using in their own drug program, right? So you're really doing all of the dots. You're connecting everything together from square to if anything is loose that needs to be done with your team in your lab, in that base work. It can be the marketing side, what you post on social media. At any point, if someone wants to contact me and speak with me about the science, the best person to speak about your company is you. You and your scientists are the best people. And a lot of people look on how they can outsource or who they can get to help. And it's great to have people help with your team. But when you go in and you move biotech or anything forward, you want to know how all those components work. So for a person, for me at least, regardless if you call me the CEO or a vice president, whatever role I am, I'm going to understand how all those pieces work. And that's what contributes to that success, is making all of those pieces and understanding how all those pieces fit together and work. And not only do you have to understand how those pieces fit together within your company, you have to understand how they fit in with someone else's company, with the vendors that you're working with everyone else, because everyone has their own chess piece to their own chessboard with their own goal. And you have one as well. And you have to learn how that works within that environment.
So how prescriptive are you about the acquisition process? Like, how early? Okay, so you start with some level of excitement about some technology. You think it could solve some big problem, make some big impact in the world. You're excited. It gets your attention. But at what point in time do you map out, okay, these are the 10 companies in the world that are our pool of potential acquirers. There's 3 of them that are a little bit further advanced. One of them is complementary with what we're working on. Like, do you just kind of let the technology develop, or is it all done at once?
So one, the short answer, and I'll go into it, is immediately. So for example, with Nature Technology, immediately. You know exactly, it might not be where you end up. I will tell you, we were pretty darn close with Nature Technology with where that home ended up. But you immediately, or at least I immediately look, because with biotech, you're not building a bricks and mortar. You're truly creating this playbook for someone else that has more resources, more, all the things that you need to take something and commercialize it to market, because I'm not going to be the individual that commercializes this and moves this out. Now, I will tell you, in the case of Nature Tech, we actually were selling, product. We were selling our vector at research grade. We were selling our plasmid process at research grade. But it took a bigger company to do that in a GMP scale that would take that to the next level, right? So essentially with this, you're in the very beginning, you're coming out and you're saying, can this find a home? So it's immediately. But what happens is you have, at least on my side, I have this glorious Excel file, and you continuously whittle of, here are these individuals, here's where it can fit, and you move back and forth. And sometimes you'll move, like within the case of Nature Technology, it was moving back and forth where, well, do we really see this like sitting with someone like a Genentech or Pfizer or AstraZeneca, or is the play really sitting back with a manufacturer? And I'm sure a lot of people that are maybe listening to this right now or watching through LinkedIn or whatever social source will understand, all the talk about manufacturing and the boom and can we manufacture drugs efficiently and where it's at. So with Nature Tech, we kind of had this twofold of where it would fit. So you're really looking for where the best home of your technology is, and it grows. And so you're asking, like, in the beginning, maybe you didn't know something about your technology, or also, as we spoke about, the chess piece and everything's moving. And so I love when people come to me and they say, I read an article and so is interested into oncology in this space or this drug. They're interested right today. Because if they're interested right now today, depending where your technology is, it could be that they've already made a decision with what they want in their portfolio. You might not be a match later, but it's good to target those. So it's always moving a little bit, but you do have an idea. So it's immediately, I would never go into a company in this particular space without that end in mind and work through that first. I'm a person that actually works at the end of that playbook, and then I work all the way forward, and then how do we get there?
So you start with what does the path to success look like, or what are the possible paths to successful outcomes? Yes. And then you walk back and you sort out what needs to happen to get there.
Yes. And it's interesting because, in biotech, you also have to find what shots are there, because there's also and we had this conversation last week in one of our meetings that we had just about biotech and science, which is, out of all the industries, biotech, there's a large group, in every industry, there's a large group of individuals that are very green that do not know what they're talking about. But biotech is really interesting because you have people that are kind of sold on a particular type of research, or maybe they didn't read all the same articles. It's very suasive, and, maybe someone believes in a different kind of vector, or they believe in a different kind of genetic target, or they've read something 7 years ago that doesn't pertain today. So you're always walking through, like, even though you have those end targets, you have to find out, like, what does that path really look to get there? And it's never just completely forward. I mean, it can take deep dives, and that's why those relationships, are very important, because you never, if someone says, this isn't really something I'm looking at right now, or my portfolio is full, we've already maxed out on oncology products, or, there's some dead giveaways if you're speaking with someone, like if I'm speaking with someone right now that's looking for a health tech company and their only interest is in health tech company, if I ever come back to them with a company that's not health tech, they're probably going to say no, right? Like, we don't want to hear anymore. However, it doesn't mean you just end that relationship, because there could be something else that they work with, right? Or you work with something else. But with biotech, it's really learning, and you can transfer this to other industries as well, but it's really learning how to pivot and move to where that endpoint is, because you only have so much burn rate, what it takes to get to a clinical trial. And then I think a lot of times what happens too in this journey is people lose sight of where the exit is, or where that endpoint is. I think we all talk heartedly about the unicorn exit and getting your company acquired. But what a lot of people don't focus on is that meat that happens and all those intersections that happen before that exit point, which is, I think people forget where that endpoint is, and they're scrambling to answer a question that someone has, versus is answering that question or making that pivot. Does that get you to where your exit point is, if that makes sense? So then they veer off and lose sight of that. I guess you call it true north, right?
Right. Okay, so after you've identified your potential acquirer, and then you have some level of dialogue, you have some indication that they're looking to make investments in your space. So now you have this race that you're running, trying to close that gap. What are you usually competing against? Are there other dubs out there with similar technology, and then the acquirer is choosing like which horse looks like they're going to win the race? Are you competing against their priorities shifting, and then they're just developing apathy in your space and they're building out drugs in different areas? Like what worries you on this path to close that gap?
Well, at any given moment, anyone can change their mind. So you control nothing. This is truly the most riskiest, stressful, but rewarding career you will ever have. So one, you're competing against yourself in some ways, right? Because you mentally have to be in a great space to do this. You have to be very sound in your footing in what you do and understand. And that's why when I explained understanding how each part of your company works, understanding that is so important, because you are racing against time in some ways, right? So people can change their indication. They can have interest now. They won't have interest later. There can be some other, there can be another Deb out there that is a CEO of a company.
A bad Deb.
Yeah, no. I mean, no, there's a lot of people out there. I thought about this today prior to meeting with you, because think about it. Sitting at a VC firm, you're going to hear about all of these companies that have a cure for cancer or fighting cancer, or they have this great technology that can, be used with AI, to move the data and do all these different things with it, right? You hear stuff, and it's a lot. So you could think about it. I prefer to call it like minions versus another Deb out there. So you have all these minions, right? So what you're trying to do is not just make yourself really show who you are in this, because that's part of it. So you have to be very transparent in who you are, who your team is, why it's important. And then hopefully that's enough to navigate you through this journey, right? So, but you have no control of it. So yes, you can get to the end point. And this is why when you were asking about how important this end result is, where you're going to end up with this technology, or because it's not just biotech, it's everything if you're looking for this acquirer, because you have to have somewhere to go. And people get really caught up, like especially in my space, they get really caught up, well, go to a phase 1 trial, get clinical results. Well, I could have all the clinical results in the world, and it doesn't mean that someone's going to acquire this company and move it forward. It also has to fit that company's bottom line. So just like Danaher, when they review a company, it's a very sophisticated process on what that they pick. It's a huge strategy on how these companies cross lines with each other and what they contribute to the overall arching ROI of Danaher. Then each of those companies below has a ROI and a contribution of what they have to achieve. And so you're part of this big scheme. And so it's taking, someone can lose interest, that key player, that key target you have. Maybe they don't want to fund anymore in this space, or they've changed initiatives. In fact, Nature Technology, we had some licenses, the way we played up our technology before it was acquired. Our goal was to have a few licenses by bigger companies using it. It just kind of showed this proof of concept, this model that a bigger company could acquire. And we had a larger pharmaceutical company. Tons of time were put into this, and they completely pulled the plug in the space and just outsourced their whole R&D team. This was like a huge license loss, but we also had a giant playlist of a lot of other people that would use our technology. It wasn't just on that one person, right? We had multiple ways the technology could go through. The same with acquisition. Just because you've signed an LOI and someone says they want to talk to you about purchasing your company, it doesn't even mean the journey's about to be done. Because at any point, even when a person says they're 100% interested in you and they want everything that you have, they could come back and say, this is done. They could challenge your IP. Something's not strong enough. Intellectual property, by the way, is IP. They can find things when they're going through your books and everything's over. And you just have to find a way to pivot and move forward. So
sounds like dating.
It actually, it's funny. I was thinking about that. It's very much, I was thinking, it's like, man, it's very much, and you have to decide, like, who is this that I want to spend my future with? And actually, that's what I think about for the acquisition, right?
Are you really spending your future with them? Or,
actually, you are.
Or are you getting your check and buying your Porsche?
So I will tell you. I do. I have a fondness for cars, and I will tell you that actually running, although it sounds like it's a very affordable sport, or bicycling, or whatever you do, I'm very low maintenance, but my hobbies are very high maintenance. But no, you actually do. It's not, and I'm so glad you brought this up, because this isn't just you take a check and you walk away. Or at least in my book, it's not you take a check and you walk away, or you find a home and you make a relationship is continuously moving forward. And you're not a relationship builder if you find a home and you just never contact again. That's kind of weird, right?
Right.
So this is truly, you're finding, and especially for biotech, the goal is you want to see that technology be commercialized, truly helping patients, truly helping physicians. And so it's about creating this playbook, and whoever is this final suitor of your technology, giving them all the cards they need to be successful. So with Nature Tech, we did that. They had a lab they could count on. They had a scientific team. And so in that handover process, we also had who all would use this vector, who are people that they could work with, and really a market play. With Crixter, it's the same. We have multiple oncology indications we're going after. We're looking at NRF2. So but this is important.
Let's start from the beginning with Crixter.
So, in terms of how it was built, or...
Okay, so you were the CEO of Nature. You had that exit. Your life changed, but your motivation for impact to create another exit was still strong. You joined Cortado as an entrepreneur in residence as you were looking for that next opportunity. What is Crixter, and then why did you choose it?
So Crixter is a platform technology, and we are looking at resistance factors that basically make it where a drug doesn't work. So we are our indications that we're working on right now. We can look beyond oncology, but we were actually birthed and researched within an oncology unit, and we are looking at oncology resistance. So we're going to knock out a gene so we can actively treat the patient with standard of care. And really, to go into what turned me, I guess, on to Crixter and made that exciting. So it's interesting. So, you talked a little bit about the acquisition of Nature Tech. And one of the things that I didn't do, which I'm doing now, is people talk a lot about your acquisition, but they don't talk about what happens after. I think that there's this story that your company's acquired, everyone wakes up the next day and they pull up to the company parking lot and there's all these new cars. So you knew something great happened, but they don't really talk about the steps after that. And for me, I knew I wasn't done. And I really did. I came across Cortado. I knew about Cortado, but I'm also friends with the individuals that work here and was able to sit as an entrepreneur in residence at Cortado. And I knew I wanted to do something else. I was actively searching. And Crixter actually was an introduction to me by a friend, a relationship, go figure, from a retired pharmaceutical executive from AstraZeneca.
So is this common that scientists who are working on something cool are hunting for their Deb?
They are, or they should be. And I don't know if this, and this is interesting you asked that, because Nature Technology, I met them years prior. Yeah. And then it was their scientist that invented the technology that was on the hunt. And it was like, I need you. And he had this whole entire I mean, one, the technology has to be interesting, right? And then two, you really believe, at least on my end, you believe in the scientist and you believe in their dream, you believe in their mission, you believe in their crazy, because they have to be a little crazy to do this. And you just want to see their dream move forward. And that's how it was with Nature Tech. And to sit there, a friend of mine, like I said, that I knew for years, introduced me to Crixer. And he didn't just introduce me. He actually caught me off guard. And I told this story. I was at a biotech reception at a conference. And I was really just trying not to talk to anybody. That was my goal. And believe it or not, my grandmother had just passed away. And I was so happy to see a familiar face. I was planning on seeing him. And he told me, he's like, hey, what would you do if there was this technology out there and you could target a gene that was looking at resistance, and if you were able to cancel this resistance out, you were actively being able to treat a patient. And you could do this, basically you could look at different genes, and you could do this for multiple indications. And I paused and I thought, this is a candy store. So meanwhile, this gentleman, which his name's Chris, was messaging the founder of Crixer and his wife. The next morning, I sat at the Oklahoma Bio Pavilion booth at Bio, actually, and discussed their technology. And they have a whole entire research lab. This was spun out of ChristianaCare, the hospital system. They formed a nonprofit, Gene Editing Institute. So Delaware is actually right next to the whole Pennsylvania gene editing, gene therapy consortium, right? And they have this amazing team of scientists and years of research, and they're just ready to go to a clinical trial, and they need someone to get them there. And they're looking for that person. And I knew immediately, like, this is where I wanted to give my time. There was no question. And working in the oncology space to kind of start my career and then come back to it and use those relationships and connect all the dots. It's kind of fun, doing it this time with all those people you've known for so long.
This is really interesting because biotech operates so much. It's just so different from the rest of early stage startups, right? Like if a pre-seed founder walked through the door at Cortado with the B2B SaaS and they spent half their presentation talking about acquisition 7 years down the line, we would think, okay, this person doesn't understand where the rubber meets the road. They need to learn from the school of hard knocks, and then maybe they can come back to us and be a little bit more realistic. But it sounds like in this game that you're playing in biotech, where you're trying to advance something to that next stage of clinical milestones, but you're also trying to hit your own interpersonal, like, relationship milestones. And it's like you're working on all these different projects in concert, and it all has to come together. And the same period of time before somebody changes their mind, they leave. Some other Deb swoops in and gets married to the company that you were in the process of. How do you keep track of everything? Like, how do you keep your sanity? Like, how do you prioritize? It just seems like a lot.
It is a lot. This is not for the faint of heart at all. So I will tell you, I do have an Excel spreadsheet with all the moving pieces. I call it kind of my March Madness. So for those familiar with basketball, it's kind of like where your Final Four is, and then, your championship, but then you have all the teams, all the players. That's really how I look at biotech, because there's so many moving pieces. I would probably find this kind of atomic habit in any company I work for, but that's how I grid this. I will tell you, though, even though I do take notes of the individuals I meet, because it continuously changes. So a company today that might be hot in my eye, and actually with biotech, it could be by noon today. It's like, 8 a.m. right now. And so by noon, I could sit here and tell you, Cody, this is great. This is my lead person. This is perfect. by noon today, it can all change. It's inevitably, it's always moving. And even though I know where these moving pieces are, I also take a lot of notes and kind of have this grid spreadsheet. And that's how I keep track of it. But what happens, it becomes very, I spoke about knowing all of the pieces of your business and why that's so important. And that's part of the reason why, or actually all the reason why it's that important, right? Because if you can break down your business in the smallest key and know where all the moving parts are, then when all these other pieces are moving, you can connect them so freely. And I can tell you now, after having conversations, over the years, and especially here recently, because I've been asked this question too, I don't think this is something you can necessarily learn. I think you just have to want to do it. You have to want to roll up your sleeves and do the work, right? And if you want to roll up the sleeves and do the work, you find your own playbook. So not everyone's going to have this March Madness grid. It's not going to look the same, but this is what works, for me. And it is a lot. Now, how I decompress or how I keep it all going, I'm doing better, actually. Russ Rother, that had his exit with Solexis, and now he has Tetherex working on another company. He was asking how, just it's funny how you meet with other people that have done the same thing, and they're really just checking how your mental health is or where you're at. And he's like, it looks like you're doing really great. And I was like, I've been running a lot. I've been cycling my heart out. So you just find places where you can basically disengage, and you have to, whether that be locking yourself away for 24 hours and not answering your phone, which is almost impossible in this space, if not impossible, or just going out for that run and looking at that sunrise. So that's really what helps me come back and circle it together. But then I can tell you, like, just when you feel like you're beat down and you want to cry and hand in the towel or whatever it is, like you get maybe all of your dartboard that you thought was plentiful ends up with one, right? Right when you're in that moment, someone brings you, maybe their kid to talk to you, and their kid, or maybe it's even a friend saying, man, we don't know how you do it. You inspire us. Or a friend tells you that their sister has cancer, and this is bringing hope, maybe not for her sister, but for someone else. And you're reminded this is why you do this, and it's worth the sleepless nights and having a little bit of stress, right?
Incredible, Deb. Well, just being a part of the Cortado family, I know that everybody's super proud to have you as our rockstar biotech Porco CEO. But it's just really cool seeing how you've put together this whole package to be a dangerous biotech entrepreneur, right? You started out with childhood passion for medicine. You understand the science, and then you have the social skills to be able to network and to form genuine relationships with potential acquirers, with other industry professionals, with the scientists. You have the humility to be the CEO who's doing the dishes before everybody else shows up. You have the organization to have your March Madness spreadsheet so that you're keeping track of all of these different races that you're simultaneously running while you're actually running marathons and cycling races. Whenever you're ready to share how you've manufactured more hours in the day than the rest of us, then we will have you back on the episode.
Oh man, I would love that.
For the good stuff.
Well, thank you so much, Cody. It has been a pleasure. And, likewise, I think you are also a rock star in what you do. And so as I'm always excited to speak with you and have you cheering me on, I hope I can do the same for you. I mean, this has been a great journey.
Well, I hope I'm as successful as you too.
Have a good one. Thank you.
Okay. Thank you. See you.
Thank you for joining us for another episode of the Midcon Markup. Please hit like and subscribe for more episodes.